Hi, I'm Danielle Matias at Caring Medical, talking today about a common injury that we see patients for called Ischiogluteal Bursitis. Now, a lot of times this might just be called pelvic bursitis or bursitis of the pelvis, but the real term is Ischiogluteal Bursitis. If we look back here at this image, what this condition is basically irritation of the bursa or injury at your butt, at the bone that you sit on. So if we look here, just to kind of orient you, this is the back of the pelvis. This is the tailbone here in your sacrum. These are your hips. And then this right here, this is your hamstring. So on the back of your thigh. This piece of bone is called your ischial tuberosity. It's commonly called your sits bone. And that's where your hamstring tendons attach. And right in here, you have something called your ischiogluteal bursa. Now, bursa are fluid-filled sacs in your body. You have them throughout all of your joints, and the purpose of your bursa is to decrease friction between layers of tissue, such as tendon and bone, so that there's a kind of a smoother glide as you move your body and move your muscles. When this bursa or any bursa gets irritated, it can be very, very painful. Like a lot of times patients can't walk, they can't sit. They might be people that you walk in an exam room and they're just standing, or go to a dinner party and they don't want to sit down because it hurts too bad, or they might only be able to sit down for a couple minutes and then they got to walk around to calm the pain down. In acute cases of bursitis, like someone maybe fell, landed on their butt really hard, acute cases of bursitis usually heal really well with rest and ice and just kind of taking it easy. But chronic cases, people that have been diagnosed with bursitis months and months ago, and they've done all the rest, they've done all the ice, they've maybe had steroid shots, they've been taking all the anti-inflammatories. In patients like that aren't getting better, there's often an underlying cause or an underlying injury that's irritating that bursa. And in this case, with the ischiogluteal bursa, it's the hamstring tendons. Now, these tendons here, if they are injured or they become degenerated, they develop what's called tendinopathy or tendon degeneration, what will happen is they'll thicken. They'll actually swell and they'll thicken. And in this area, it doesn't leave a lot of room for extra space. So if you've got this thick tendon there, what it's going to do is it's going to push and just irritate and just, in anger, essentially, that bursa to the point where it swells and then causes its own set of pain. So again, in someone that has been diagnosed with pelvic bursitis, they've done all the quote unquote traditional therapies and they've failed that, we got to look for another cause. And again, we see this a lot where they actually have significant tendon degeneration of that attachment at the sits bone that's angering that bursa. And if we can get that tendon to heal, get those injuries to heal, get new cell growth there, and get that tendon to actually get back into normal size, we can get the pressure off the bursa and relieve that pain for patients. Part of this too is even the degenerated tendon is going to be painful. So in these cases, a lot of times it could be the bursa and the tendon that are actually causing the pain together. And by working to heal the tendon with prolotherapy, PRP or platelet-rich plasma, or a combination of both, we can actually get this condition to resolve.